of patients. The provision of care and support for people living with dementia, particularly at later stages of the condition, is very costly. These costs are mostly borne by family members. At the same time, family ability is decreasing as a result of demographics, societal and economic changes. It is important to note that dementia is not part of normal aging. 40% of dementia cases could be prevented or delayed by targeting 12 risk factors throughout life. To address dementia risk, it is recommended that there are policies as well as individual efforts to increasing physical activity, providing primary and secondary education for all children, decreasing harmful alcohol consumption, preventing head injury, stopping smoking uptake, and supporting individuals to quit smoking, reducing exposure to air pollution, preventing alcohol misuse and limit drinking, and reducing obesity, reducing diabetes, increasing social contact, reducing and managing depression. Ladies and gentlemen, COVID-19 has disproportionately impacted people with dementia, with around a quarter of the virus deaths in certain countries being those of people with dementia. In other countries, at care facilities, many people with dementia have been hit hard when exposed to the virus. This is because they cannot remember the containment measures that are critical to the fight against the virus. Therefore, they need compassion, love, and understanding. In countries with residential care facilities, COVID-19 restrictions implemented to curb the spread of the virus have resulted in interventions that could have accelerated physical and the ability to learn new things, cognitive decline, or indirectly contributed to deaths observed in residential settings. Globally, there are 50 million people living with dementia. Someone in the world develops dementia every 3 seconds, and the number of people living with the disease is predicted to triple, rising to 152 million by 2050. The economic burden of dementia is estimated as approximately US $1 trillion every year, a figure that will double in 2050. About 80% of the general public are concerned about developing dementia at some point in their life. About 35% of caregivers across the world have hidden the diagnosis of dementia of a family member due to stigma, and over 50% of them say their health has suffered as a result of caring responsibilities, despite optimism about this role. Kenya is honored to be among the 7 countries globally involved in the STRIDE project, the project strengthening response to dementia in developing countries. This project is a collaboration between the London School of Economics and Alzheimer's Disease International. As part of STRIDE Kenya team, the Ministry of Health is part of this project that consists of Africa Mental Health Research and Training Foundation, Alzheimer and Dementia Organization of Kenya. The STRIDE Kenya team's mandate is to implement and evaluate an anti-stigma toolkit in local communities in order to reduce stigma towards people with dementia. and increasing help-seeking behavior and access to care. The Ministry of Health is also working closely with the World Health Organization and other partners towards developing the National Dementia Action Plan, positioning Kenya among the first countries in Africa to develop such a plan. Turning now to our COVID-19 situation. Today, 98 people have tested positive after testing a sample size of 1,644 over the last 24 hours. This brings our total number of positives in the country to 37,079, and our cumulative number of tests that we have conducted to 518,350. From today's 98 cases, 96 are Kenyans and 2 are foreigners. 63 are male, 35 are female. The youngest is 9-year-old, the oldest is 75. Distribution by counties is as follows. Nairobi leads with 32 cases, Mombasa 20, Meru 8, Uasin Gishu 8, Kiambu 5, Kisumu 4, Migori 4, Machakos 4, Elgeyo Marakwet 2, Kilifi, Taita Taveta, and Muranga 2 cases each, Garissa, Kwale, Embu, Samburu, and Nakuru 1 case each. The 32 cases in Nairobi come from the following sub-counties: Embakasi East 5, Dagoretti North and Westlands 4 cases each, Embakasi Central, Kamkunji and Roysambu 3 cases each, Dagoretti South, Embakasi West, Kasarani and Langata 2 cases each, Kibra and Ruaraka 1 case each. The 4 cases in Kisumu are all from Nyando. The 4 cases in Migori are from Rongo 3 and Suna East 1. And the 4 cases in Machakos are from Machakos Town 2, Athi River and Kangundo 1 case each. In Elgeyo Marakwet, the 2 cases are from Keyo North. The 2 cases in Kilifi are from Kilifi North. The 2 cases in Taita Taveta are from Voi. And the 2 cases in Muranga are from Gatanga. The 1 case in Garissa is from Dadaab. The case in Kwale is from Sambweni. The case in Embu is from Runyenjis. And the case in Samburu is from Samburu Central. The case from Nakuru is from Nakuru East. On a positive note, 62 people have recovered from the disease, 44 from home-based care program, and 18 have been discharged from various hospitals where they were being cared for. The total recoveries now stand at 23,949. And once again, we take this opportunity to thank our healthcare workers for their diligent and dedicated work and service to duty. Unfortunately, we have also lost 2 patients to the disease, bringing the total fatality to 650. Our sincere condolences to the families and friends of those who have lost their loved ones. Finally, I would like to extend our deepest gratitude to the government of the People's Republic of China, not only for the donation that they are making today, but for the support, steady support that they have provided to us throughout this pandemic period. In fact, China was one of the first countries to step up and provide us with support in forms of donations very early on in the pandemic. Today's donation, and you will hear about it a little later, is a donation of ventilators that will help us to be able to equip some of the facilities that require these ventilators to take care of critically ill patients. This donation will go a long way in assisting our healthcare workers and health facilities as we fight to combat this virus. I think we will now break for the question and answer session, after which we will then go through the donation process. But before we get to the question and answer, allow me to invite His Excellency the Ambassador of China to say one or two words about today's donation, and then we can move into question and answer. After that, we will go and receive the donation. Please.
Thank you. Honorable Dr. Rashid, CIS for the Ministry of Health. Mr. Lindsay Kiptonis, Director for Asia in the Ministry of Foreign Affairs. Dear friends, first of all, I would like to express our appreciation and gratitude to the government and the Ministry of Health in particular, and the people of Kenya in fighting this disease. We applaud your good work, and we applaud your progress. You make us safer, everyone in this great nation. COVID-19 is a common enemy for all of us. To defeat the pandemic, solidarity and cooperation is our best weapon. China and Kenya are good friends, good partners, good brothers. Since the outbreak of the COVID-19, we have supported each other, helped each other. The cooperation and mutual assistance in the fight against COVID-19 between China and Kenya represents a prime example of solidarity in the face of a disease. China will never forget the invaluable support we have received from the government and people of Kenya at the early stages, the most difficult time of China's response to the epidemic. We will continue to do whatever we can to support Kenya's response to the COVID-19. In June this year, President Xi and President Uhuru Kenyatta both attended an extraordinary China-Africa Summit on solidarity against COVID-19. China will earnestly implement the outcomes of the summit. We believe with joint efforts, with solid solidarity and deepened cooperation, we can defeat this COVID-19 together. Thank you very much.
Thank you very much, Your Excellency. Once again, our sincere thanks and gratitude to the support provided by the government of the Republic of China. It's very much appreciated. I think we can now take a few questions.
Nayoma Sampao from NTV. My question is, today some medical officers in KNH issued an ultimatum that in 1 week they're going to strike. As the Ministry of Health, what are you doing to intervene with SRC to ensure that their demands are met? And them demanding to go on strike for the second time, does that mean that there is failure on the part of the government in this fight against COVID-19? My other question is, about 2 weeks ago, you said that our numbers have reduced because of our testing capacity. We do not have reagents. Would you kindly update us whether the reagents are here, and why are we still testing low samples?
Hi, my name is Graham Kajilo from The Standard. My question is with regards to reopening of schools. I understand that you usually say that the decisions that you make are informed by numbers. So do you mind sharing with us any projection that you see ahead when schools reopen or when the president decides to reopen the economy?
Saida Hassan, Standard. My question is, we have isolation centers in Nakuru County being closed down. What will happen? Some of these facilities are being closed down, yet we're still witnessing that we have numbers of COVID that are still being reported. So what is the ministry doing about it? And also, about Pumwani issue, do you see at a point where us as a country will start training the people we employ in our hospital facilities from the gate? That is the guard at the gate. We train them on the basic necessary skills like first aid. Thank you.
Okay, thank you. Regarding the issue of medical staff at Kenyatta National Hospital, as you stated, saying that they will go on strike, it appears from what you said that there is an issue with some of their grievances that they have put forth, which might require addressing by the Salaries and Remuneration Commission. I think labor issues are things that we cannot run away from. They're always there, and they will always continue to be there, as labor organizations and unions always try to get the best deal for their members. So we will continue to see calls for strikes, calls for better enhanced terms of service. All of these calls, though, however, have to be looked at very realistically in terms of what's available and the resources that are available. It's a process of dialogue and discussion. Those discussions are being held even as we speak, because we always do respond to any issues that come up regarding labor relations, and we try to solve these problems through dialogue to the best of abilities of both parties before they get to a point where now, labor action is taken. So I can assure you that this is a matter, since it is only KNH being a parastatal, it's a matter that is being addressed, and I'm certain that it will be resolved in due time. Regarding our testing capacity and whether we are now experiencing a low level of reagents, I would say from the numbers of samples that we are testing, indeed we do have some challenges in the area of receiving reagents. We have stated here several times before that there are global challenges in receiving some of these reagents, particularly certain types of reagents. In this particular case, we are experiencing difficulties with what we call the high throughput platforms that we use. These are products largely coming from the Western world, where the demand is extremely high, and we have not yet received the scheduled shipments of these reagents that we were anticipating. However, we will continue to test, and we are testing, and our numbers that we test, even though they may not be as high as they were before, still give us an indication of where we stand in terms of our curve, because we always look at those numbers in the context of how many turn out to be positive and how many were actually sampled. That denominator, when we use that denominator, it continues to give us the kind of information that we rely upon. Graham, the matter of opening schools, as you know very well, this has been an issue that has been discussed extensively extensively, and even as these announcements are being made, I think there is still a level of discussion on this issue of opening up schools. There is an approach of possibly using a phased approach and opening up certain schools, certain classes to begin with, as we observe how the disease then, the curve progresses after that. I think the country is determined to take the safest route of reopening without creating a distortion that will lead us back to where we were some time back when we were experiencing very high numbers. We are very much aware, we have seen experiences in other countries where on opening up certain sectors of the economy and the social sector, you see spiking of the numbers. I think we need to be very, very careful about that, and therefore a very careful approach, a very phased approach is going to be necessary, and I'm sure that the Ministry of Education, together with our ministry and other relevant ministries, are looking at this very carefully as determinations are made on which parts of schools or what type of schools and what classes will be opened up in the beginning. We have not yet defeated COVID-19. Transmission of the virus is still there with us. Our numbers might show that we are, to some extent, the measures we have put in place are yielding some results in suppressing part of this transmission. But that's as good as we continue to maintain those measures that we have put in place that actually do tend to suppress or break the cycle of transmission. And therefore, it would not be wise and it would not be prudent at all for us to begin to think that we can now close down some of the facilities that we prepared for this COVID-19 just because we are seeing a different picture right now. I think as was said even yesterday, the other day, we need to continue to keep our level of preparedness at that level we were at before and not bring it down, because as certain areas of the economy are opened up, we are likely to see an upsurge in cases. Therefore, it's very, very important that we continue to have that ability to be able to deal with any surge that might come about because of certain events that may have taken place. So it's unwise to close any facilities. We are urging all our counties to be able to continue to maintain those facilities at the level they are at in terms of the equipment that is there, in terms of the human resources that have been deployed there, and the level of readiness that has been achieved. I think that completes my response to the questions that were posed. At this point, I think we can move over and receive the donation. We shall begin by signing the certificate of donation.
Yes.
Just exchange.
Okay. Your Excellency, I think we can move over to the point there.
Beat sensitivity pain fast with Sensodyne Rapid Action for clinically proven relief in 60 seconds.
Alright! Gael is having a bachelor's party tonight, Sam.
What? You should go and see Gael.
I'll only end up fighting with my sister.
As long as there's no ring on her finger yet, you still have a chance.
Samantha, stop it!
I still love you until now. Why can't I be happy like you, Anna?
Your happiness shouldn't depend on someone else.
Well, that's so easy for you to say because you refuse to give me the only man I've ever wanted in my life.
This wedding cannot take place.
What's wrong with it, sir?
Dad, Abu told me that his dad is retiring. What about you? Are you going to retire?
2020 showed us to never say never. Ensure your happiness with APA. Should never, ever happen.
You have been chosen to come here because you are the best journalism students in Kenya.
If your content is not interesting to look at, don't waste my time.
You submitted your work late. Why?
Each and everything that we used had problem.
No excuses in the newsroom.
Just let it go because it's a teamwork, for heaven's sake.
I think you should go home.
What if you don't agree with what he said? Will you say, So keep that.
Tumechoka, tumebit, tumezunguka.
Ni noma.
Along came one.
It looks like Lushan is sticking her nose into things that are none of her business.
This isn't the right time.
He was always after me and everything was just going great. Until Marta got in the way, just as she did with your father.
If there's anything that concerns my children, you have to tell me about it. Do you understand? Excuse me for interfering, but if Luciana didn't... But still, she doesn't have any right to keep from me anything that has to do with my children. Yes, but...
I don't even want to think about how much trouble she's in.
Luciana, the fact that I can't be with you doesn't mean that I can just forget everything I feel for you.
Are you alright, Madam Lillian? Is anything wrong? It's nothing you can fix. Nobody has the cure for love problems.
Along came love, in association with Blue Band Peanut Butter.
Rwanda has seen steady economic growth in the last decade, and this has created a fertile ground for the diaspora to return home as they are also seeking greener pastures. But how has the country facilitated their return?
In a month, we are looking at about 30 patients. That is a huge drop from way over 100 patients. We are now using technology more because now we are having to consult through the phone and through avenues such as WhatsApp, which can allow you to video call.
Did you know there's a laundry bar soap that can help save you time, water, and money? You save by not having to use multiple products. And you only rinse once. For a laundry soap that can help save you time, water, and money, try Whitewash Extra. Brand power, helping you buy better.
Fact Finder from the BBC.
Were these Chinese officials taking coronavirus victims for execution as claimed in this video? We went digging for the answers.
Will Ethiopia's new law curb the fake news menace in the East African nation? We hear from tech experts.
We'll also have tips on how you can spot a fake story online.
And are robots here to help, or will they take over the world? We find out.
Dad, Abu told me that his dad is retiring. What about you? Are you going to retire?
2020 showed us to never say never. Ensure your happiness with APA. Should never, ever happen.
Tabisila's first letter was a doctor's note. Why do you think that? If you have a friend, maybe they're unwell, maybe they're at home, maybe you miss them. How about you write a letter and let them know how you feel?
Join us every Monday at 8 p.m. with Grace Ekirapa on the Nighttime Tales.
Dad, Abu told me that his dad is retiring. What about you? Are you going to retire?
2020 showed us to never say never. Ensure your happiness with APA. Should never ever happen.
You have been chosen to come here because you are the best journalism students in Kenya.
If your content is not interesting to look at, don't waste my time.
You submitted your work late. Why?
Each and everything that we used had problem.
No excuses in the newsroom.
Just let it go because it's a teamwork, for heaven's sake.
I think you should go home.
What if you don't agree with what he said? Will you say, So keep that.
Tumechoka, tumebit, tumezunguka.
Ni noma.
When the world changed, it made us go back to the simple joys and love the little things even more, like serving up your best, eating together, and sharing more. Now, we'll take nothing for granted and always remember to taste the simple joys. Coca-Cola, taste the simple joys.
Je, maumivu ya kichwa na kukosesha amani? Kaluma Strong hutuliza maumivu ya kichwa, maumivu ya mwili na hata huondoa joto jingi mwilini. Kaluma Strong ina aspirin kama kiungo. Maumivu yakizidi, muone daktari.
This is NTV.